this computer. All right. So this is episode one of the Health Education Podcast with me, Mr. Vega. And today we have our guests. Please introduce yourself.
Hi, my name is Roman Sotelo. I'm a physical therapist.
All right. Thank you for joining us, Roman. I appreciate it. So I just wanted to start off by, I guess, just asking you, what is your educational background?
I'm a bachelor of physical therapy. Yeah. So, and I studied my master's in physical therapy too, but I didn't finish it. So
Okay. And did you complete your degree here or in the Philippines?
I completed my degree in the Philippines.
Okay. And how long ago did you come here to the States?
10 years ago, I came here. I don't know. It's like maybe 2008. I came here.
Mm.
So that's 12. Is it 12 or sorry?
2008? Yeah, 2008 till now, 2020. Yeah,
Yeah,
it's 12
12 years.
years. Yeah, roughly. Okay. I guess the first question I want to ask you would be, why did you become a physical therapist?
When I was young, I always wanted to be a doctor. Um, but my aunt who lives in here in the states,
Mm-hmm.
uh, Washington State. She's
Mm-hmm.
a geriatric um, doctor.
Mm-hmm.
She encouraged me to like take up physical therapy
Mm-hmm.
because it's one of the like in demand like occupation here in the United States before.
Mm-hmm.
So she told me like to take like physical therapy, and if I wanted to be a doctor after, I could still
Mm-hmm.
like continue my education to be a doctor.
Mm-hmm.
So I took like physical therapy, like a bachelor's of science in physical therapy, and after I graduated,
Mm-hmm.
I actually did pursue medical school, and I started working in hospital. And after working in the hospital for 5 years, I
Mm-hmm.
applied going here to the United States, and luckily I was the I my application for a working visa
Mm-hmm.
approved, and I started like migrating here in the United States.
Mm-hmm. Okay. All right. Thank you for sharing your history. As a physical education teacher myself, I guess one of the questions that I wanted to ask you would be, when you were in high school, right? What were some of your favorite activities in physical education class, and how did any of this relate, to what you do now? Physical activities as an adult.
Yeah, like during in high school, I every year, actually twice a year, you could like
Mm-hmm.
choose like two elective courses. Like choose like two sports that you want to like try for that school year.
Mm-hmm.
So yeah, like I can like chose like different sports to try, like
Mm-hmm.
table tennis, like swimming, basketball,
Mm-hmm.
and yeah, so that's how I like I get like exposed to like sports and
Mm-hmm.
like fitness. And also in college, we also have like physical education like courses
Mm-hmm.
our first 2 years. So I also took some like lessons and then like softball,
Mm-hmm.
um, have like gymnastics, and all those things. And also during high school, I mean sorry, not high school, in college, I
Mm-hmm.
also like joined the varsity for fencing. So that's
Oh
also,
wow, fencing. And how
yeah,
long how long were you on the team for?
for 3 years. Yeah. Mhm.
Did you win any titles or did you travel, within the Philippines or?
It's a fairly new sports in the Philippines,
Mm-hmm.
fencing. I
Mm-hmm.
mean, that time,
Mm-hmm.
we're actually like, I am part of like the pioneer fencing varsity in our university, which is
Oh.
University of Santo Tomas. So we had like competitions, but it's inter-university competition. It's, we call
Mm.
it AAP,
Okay.
and I participated in that like game.
Okay. Okay. And now that you're an adult, what is some of your favorite physical activities to do? Obviously, when you're not working.
Um, Now I usually just like do running.
Mm.
I participate in like New York City runs.
Yeah, we did that together last year. Remember that midnight
Yeah.
run?
Uh-huh. So that one, I run the marathon
Mm.
twice already.
Mm-hmm.
So the New York City Marathon. So that's mostly after work. I just like run
Mm-hmm.
like 3 to 4 miles every day, and then I keep myself like you know like fit and healthy.
Okay. All right. Good to know. Um, Obviously, I know that you're a physical therapist, but if you wouldn't mind sharing, what is your current, job title, and how did you, arrive at your position?
Yeah, I'm a director of rehab in one of the nursing homes here in the Bronx.
Mm-hmm.
Um, yeah, so I was just like like I started like a staff physical therapist,
Mm-hmm.
and I just like like had like e- experience, and and try to work my way up the career.
Mm-hmm.
So I was promoted to be like a rehab director in the facility.
Okay. All right. And if you wouldn't mind sharing, because obviously I'm doing this for my students, and I want them to see the connection between, what they're learning in my class, and then later on how they could take it on into college, and then maybe pursue career as a physical therapist. Um, would you mind saying how much you make, or if you're uncomfortable with that, what is the range of income, that someone in your position, and obviously the low level of schooling that you have, can make?
Yeah, I mean, physical therapy like usually earns around like 60,000 to like 100,000 a year. And
Okay. So that just like being a practicing physical therapist, because obviously you're the director, so I assume it's a little different, right?
yeah, I mean, as you gain more experience, as you
Uh,
gain more, yeah, like more expensive, you get to like increase your salary, and
okay.
also it's not only like just like in the facility. You could also like
Mhm.
branch out and be a practice like a private, like create like a private practice on the
Okay.
sideline, also
Mhm.
to to earn more. So it
Okay.
also depends on how hardworking you are.
Okay.
Like a specific salary is just basic salary is like that. But if you wanna pursue like private practice or home care, you could also do that after like after work or like on the weekends. So it all also depends on how hardworking you are, and how how much you put effort into your work.
Okay. All right. In my class, obviously, I teach high school students. Some of the subjects that I teach them is, kinesiology, anatomy, and physiology. How important is it, do you think, for someone who is currently in high school and wants to be a physical therapist? How important is that for the mastery of those subjects to be, an excellent physical therapist?
Well, I think that's just really like very important for you to like focus on those like subjects, so, like kinesiology, like physiology,
Uh,
anatomy. These are like basic like subjects that
mm,
you will also have to take in college. So if
okay.
you have like a basic like mastery of this like subjects, at
Okay.
least you do like physical therapy, you're familiar, and it will be like easier for you to like like have like pass or like have good grades on those subjects, and like also like help you out to like finish other like higher like subjects or something.
Okay. Um, to sort of like I guess conclude our podcast for today, the final question that I have for you is, what advice do you have career wise for a student who's 18 going into college? What would you say to them if they want to become a physical therapist? Let's just say here in New York.
Well, you have to like really love like like the human body. You have to
Yeah.
appreciate like the human body, like the anatomy, and the relationship of each like
Mm,
like muscles or bones or nerves, the
mm,
nervous system. If you have to have like a liking also to people. You have to be a people person to be a physical therapist, because you have to like
it's
always
like
like
customer service, right? I mean, obviously you're
yeah,
treating a
yeah,
customer, but
yeah,
it's a
you're
patient.
you're treating a patient. You
Hmm.
have to like you have to be a people person. You have to really have the liking to care and help other people go back to their normal function, like
Hmm.
normal activity. And also you have to have the ability also to like to
Would you say synthesize like information, like obviously between what you read, like let's say in a patient's file, and then what you see, and then use your knowledge mentally in order to help them, right? Like synthesis of information, I think is very
yeah,
important, right?
like have like a what we call like a clinical reasoning.
Mm-hmm.
Like whatever you learn in college, whatever you learn in the books, whatever you learn inside the classroom,
Mm-hmm.
you know you have to like incorporate it to like real life situations, and like it's a skill that you need to develop,
Mm-hmm.
like what we call like clinical reasoning.
Mm-hmm. To develop that skill, because students often say, oh, mister, I don't like reading a lot, but I want to go to college. How much reading did you have to do to become a physical therapist?
A lot of reading. Like memorization is like a big part of like a being a physical therapist, because
Mm,
you have to understand that you have to know every bone of your body, every
mm,
muscle of your body, and
mm,
then you also have to know their relationship to each other, and having this basic information,
mm,
it's really important for you to really advance in your studies and also advance in your careers, because if you don't if you don't have the basic knowledge of these things,
yeah.
is you really won't be able to like be a physical therapist, because you really need to like memorize a lot of things and read a lot of like books,
And I
spend.
think what also comes into play is that you also have to be able to communicate this information to patients in a way that they'll understand, right? It's like
Yeah,
you could say scaffolding.
yeah, you have to like like try to explain to them
Hmm.
what you are doing. I mean, you have to like see them, like assess
Hmm.
what's their problem, what are their needs, and also you have to be able to like communicate to them,
Hmm.
you the what are you gonna do with them, or what treatment are you planning, and also what goals that you want to like make to those patients.
Okay, okay. All right. Well, that's all the time that we have for today. I want to thank you for being a guest on the first episode of podcast of health and physical education, and I hope to have you soon again for another conversation.
Yeah, thank you. It's my pleasure.
All right. Have a good night.
You too.